The next lecture in the series is entitled Acute Thermal Burns. This happens to be a topic that is very near and dear to my heart for a personal reason. Not only was my father involved in a major thermal injury when I was a young boy, but I dedicated a significant part of my hyperbaric fellowship to the study of this area. And we'll talk about my publication and findings regarding the use of hyperbaric oxygen therapy in acute thermal burns a little later in the lecture. I want to start off with a special acknowledgement and thank you. I would like to say thank you and acknowledge Dr. Paul Ciance and Dr. Benjamin Slade. Both of these individuals I consider to be my mentors and colleagues. I worked with both Ben and Paul during my fellowship at Travis Air Force Base in California, and we spent an awful lot of time discussing the topic of acute thermal injuries. Obviously, both Paul and Ben have published widely in this area, and I took my lead and interest from these gentlemen. And so I wanted to thank them for their invaluable pioneering contributions to the use of hyperbaric oxygen therapy in the treatment of patients with acute thermal injuries. Many of the slides in this presentation were borrowed from Dr. Ciance and Dr. Slade, and again, I thank them.